iron sodium injection, which is identical by design, the steps are the same. To walk you through the process, let me introduce you to Amy, a person like you who's also using Lovenox.
Hey, I'm Amy. I'm going to show you how I inject Lovenox the same way my healthcare professional showed me. I'll be going over the steps you need to know. Be sure to tell your doctors and dentists about all the medications you are taking, including those you are taking without a prescription, such as aspirin or other NSAIDs. Also, be sure to tell your healthcare professionals you are taking Lovenox before any surgery is scheduled and before any new drug is taken. You can always call your healthcare professional if you have any questions or concerns. Remember, you can also talk to your pharmacist when you pick up your prescription. Lovenox pre-filled syringes come in different doses and strengths, so your packaging and syringe may not look exactly like mine, but the process for injecting is the same. If you don't feel comfortable injecting Lovenox yourself, you can have a family member or a caregiver do it. Just make sure they've been shown how by a healthcare professional. Make sure you inject Lovenox exactly how your healthcare professional prescribed, for the exact number of days. Be sure to take each dose at the same time every day, and don't skip any doses. Okay, let's get started. Make sure you've washed your hands, and then find a place where you can sit or lie down comfortably and see your stomach. Next, find a spot on the left or right side of your abdomen, at least 2 inches away from your belly button. Make sure to alternate sides with each injection, and don't inject into a rash or any scarred or bruised tissue. Grab an alcohol swab and clean the spot where you're going to inject. Let it dry completely to help avoid any stinging. Now, grab the syringe and remove the cap from the needle. Make sure you pull it straight off and don't twist it to avoid bending the needle. You'll see that the needle is small and thin, just big enough to reach the fatty tissue right underneath the skin. Be careful not to set the needle down or let it touch anything to make sure it remains clean. There's a small bubble inside the syringe. Don't expel the air bubble unless your healthcare professional instructs you to adjust your dose. It's safe to give yourself the injection, even with the air bubble. If your healthcare professional has prescribed less than a full syringe, point the needle down, keep a careful eye on the numbers, and expel the excess portion until the dosage in the syringe is the same that your healthcare professional has prescribed. Now, go ahead and place the syringe in the hand you write with and hold it like a pencil. Use your other hand to make a fold in your skin by pinching an inch of the cleaned area on your abdomen. Then, insert the full length of the needle straight into the fold at a 90-degree angle. Press the plunger down with your thumb until the syringe is completely empty. It's important to keep pinching that fold of skin until the injection is done. That way the medication doesn't enter any muscle, which could be painful. Once the syringe is empty, pull the needle straight out and then let go of your skin. Don't try to put the needle cap back on the syringe after the injection. Point the syringe away from you and anyone else around you, keeping your finger on the plunger rod. Then, activate the safety shield by firmly pushing down on the plunger rod until you hear a click. Place the used syringe and cap in your Sharps disposal container. And now, the injection is finished. Never throw away a used syringe, and never put the Sharps container into the regular garbage. Also, never reuse syringes. You should call your doctor immediately if you notice any of the following: unusual bleeding or bleeding that lasts a long time, unusual bruising, signs of thrombocytopenia, such as a rash or dark spots under the skin, tingling or numbness, especially in the lower limbs, and muscular weakness. Do not stop taking Lovenox without first talking to the doctor who prescribed it for you. For specific questions about your health, you should always consult your doctor or a qualified healthcare professional who is responsible for your care. Okay, that's it. All done. I hope this demonstration helps. If you have any questions, talk to your healthcare professional or call the Lovenox Patient Support Line at 1-800-633-1610, option 1. Keep watching to learn additional important safety information for Lovenox.